Hi, everyone. I am Erin, founder of Dope Dog. I'm here with Dr. Emily Stein, the founder of TEEF, and we are here to talk all things dental health. February is Pet Dental Health Month, and we're here to answer all of your questions. So, Dr. Stein, thank you so much for joining us. I'd love to kick it off with a little bit about your impressive background, and then let us know, and then we can move into some of the important tips for keeping your pet's teeth healthy.
Yeah, sure. So great to be here, first off. Thanks for the invitation. So I got pulled into dental stuff many, many years ago. And it turns out that I have the perfect storm of experience to try to tackle this pervasive problem. And so, I am such a microbiology nerd. I don't even want to go into the details, but I spent 6 years, before a total of 10 years out of my life studying and working with microbes of different kinds in various academic institutions. Got my doctorate from Berkeley, where I studied soil bacteria, how they work together to survive all sorts of stress, who gets elected to die and who gets elected to save and continue, and who evolves in response to certain pressures like antibiotics or nutrient starvation, things like that. And then due to my family history, I had a grandmother who had autoimmune disease. So then I switched and spent 7 years at Stanford trying to understand why my grandmother got rheumatoid arthritis and how to try to stop it. And while I was there, she actually had a stroke, and it turned out that her stroke was caused by dental disease. So she was in assisted living, and it turns out that if you're not able to brush your own teeth, that your teeth don't get brushed. And so she was suffering in silence, and had severe dental decay, periodontal disease, because she could no longer hold her toothbrush because her arthritis was so bad. So, basically my best friend in the whole world completely was going through this massive problem that I didn't know about. She was embarrassed to discuss. She had a stroke that changed her entire course of the rest of her life because she had to go into a nursing home. And so she survived, but I basically flew to Wisconsin and I grabbed her microbiome and I flew it back to California and I biohacked it for a year to try to figure out how to stop it from causing continual problems for her. And that's what got me into the dental side of things. And then I rescued an older Cocker Spaniel a couple of years later who had severe periodontal disease. I mean, you could smell her before you saw her. One of those things, one of those scenarios, which is sadly very common for advanced stage perio dogs.
Mm-hmm.
And rescued her. And within the first, 48 hours, we were in the emergency department extracting 21 teeth to save her life. She had to get put on a bunch of different antibiotics to clean up the infection that had spread throughout her body. We almost lost her. And it was so poignant and really highlighted this pervasive problem that can threaten the lifespan of people's and pets.
Absolutely. Well, I'm so glad you have just a couple degrees under your belt, super impressive background. And then you face this personally in two issues, humans and your dog. So it's clear that there's something really important here. What would you say, what do we need to worry about if our dogs aren't being taken care of their oral health? Because as pet parents, we are the ones that, like you said, if they can't brush their teeth, it might not get done.
Right.
So what kind of issues does having poor oral hygiene affect our pets?
Yeah, so we're learning more and more about the connectivity between the mouth, the gut, the organ systems, even the brain. For instance, our mouth is so close to our heart and so close to our brain, and there's an entire living community of microbes way below the gum line. Actually, about 60% of the tooth is below the gum line that you can't even reach. You can't even brush. You can't even floss. And that is in dogs with dental disease that festers down there because you get too many harmful disease-causing bacteria that cause inflammation, and then you get the immune system coming in like a big army charging in and causing tissue damage and trying to kill, and they accidentally kill the dog's own periodontal ligament, which holds the tooth in place. So what and it's not just localized to the mouth, and we're finding that, you know, the bacteria escape, like in Tinsley, my dog's or my grandmother, right? Those bacteria went into her bloodstream, both of their bloodstreams. My grandmother had the stroke. My dog had a massive infection all over her body. You know, eye infection, she had lung, she had kidney, bladder, it was all over, you know. And so those bacteria don't just stay put, they escape and they can migrate and cause problems elsewhere. So in dogs, it's common for dogs to have kidney problems or liver problems, definitely cardiovascular problems if they have gum disease. In rheumatology, where I was studying, there's this huge link between arthritis and autoimmune disease and periodontal disease.
Got it.
So the bacteria can go into the joints, cause inflammation, cause arthritis, and things like that.
Wow. So how can you tell if your dog has gum disease?
Yeah, that's, you know, it's tricky. It's obvious after like when you enter like stage 3, 4, it's very obvious. You know, there's gray growth that grow because plaque grows up from the gums up the tooth. A lot of folks don't even realize that. They think plaque is just on top of the
On the
teeth.
teeth, yeah.
Yeah, it's not at all the way. That's advanced stage, you know? And so you always want to keep a nice thin film of clean, it's like a really thin film of healthy plaque, growing good bacteria that help protect the teeth, help protect the gum tissue. And so you'll notice a slight change of redness in the gum line between the tooth and where the gum starts. That's called the supra gingiva, on top of the gingiva, and that'll start to get red and puffy. In some dogs, you'll notice that, and it won't be all over the mouth. It'll be one site or two sites, and that you want to look for that anywhere from the age of 1 on.
Oh, wow.
Small dogs you want to even watch during puppyhood, although they're teething, so you know there's always a transient redness and stuff. Other people, you know, don't notice until their dog's breath changes, really becomes stinky. And, you know, like puppy breath becomes non-puppy breath after a while. Like
Yeah.
when it's like, you know, you don't notice it, that's usually a healthy stage. But when it starts to turn a little bit more aromatic and more pungent, that's a sign that you've already got immune cells coming in and releasing things that are killing tissue and releasing stinky smelling molecules. And the bacteria, when you feed dogs certain kinds of dog food that has a lot of carbohydrate in it, those bacteria below the gum line secrete things that totally stink. And one of the, like, very putrid smelling and things like that. And that's not a good thing.
Got it. Okay, so my next question is, I know what the answer is, probably yes, but it's a two-part question. So do I need to brush my dog's teeth? And it's not my favorite thing. So what else can I do? Or I think we're going to get into what you've invented with teeth. Like, how can we prevent our dogs from going down this path before they hit stage 3 and 4 of gum cancer? Like,
Yeah.
is it teeth brushing, or what else can we do?
Yeah, honestly, the it's super easy to prevent for a long period of time. Like my dog honestly won't let me hit my new dog. He won't let me brush his teeth. He's chewed up every single toothbrush I've tried. And for like my cat who just crawled up on my lap, you can't he'll like
They won't.
you can't brush a cat's teeth. Come on. So, and I'm so busy, I don't have time to try and wrestle a cat to try to brush their teeth, honestly. So, the best thing you can do is to feed appropriately. So limit the carbohydrates and the kinds of carbs. Like, you know, oftentimes you're seeing certain things like chickpea and all these different kinds of alternative carbohydrates coming into treats and chews and foods. Realize that those things cause gum disease.
Is that
So
because they're ultimately sugar?
ultimately, yeah. So the bacteria are super good and they're super really good. I mean, they're really effective at breaking things down really quickly. So in a lab, I can't even move fast enough to start to measure, and the bacteria are already taking those sugars, breaking them down, turning them into acid. There's the mouth is got the second most highly abundant burden of microbes besides the gut, the
Wow.
lower gut. So it's chock full of microbes, and they're just starved. So they're eating as fast as they can and secreting. And then there's also the cycle where there's breakdown in the gut that gets absorbed into the bloodstream, also into the saliva that gets secreted. So they're constantly being bathed then by simpler sugars. And that's why they, and so acid is being secreted from these billions of microbes every minute of every day throughout the day. Yeah. And so toothbrushing is great if you can do it. But practically speaking, let's be honest, in our questionnaires, maybe 4% of our customers brush their dog's teeth.
Yeah.
And
I'll
I'm
admit we're
guessing,
not regulars over here either.
yeah. And then it's always super hard, right, to get every place effectively. And it's not like, we have to brush our teeth at least 2 to 3 times a day. It's not like I can do that for my dog. That's
Yeah, let's be
best case
realistic
scenario.
here.
Yeah. So what I do instead is I give Keshi bully sticks, or I'll give him plushy stuffed animals that he can chew on, and then I'll just throw them in the wash to wash them, because you want to make sure you constantly clean whatever goes in their mouth.
Mm-hmm.
The water bowl, clean that as much as you can, soap and water every day or every other day, because that's also chock full of microbes.
Okay.
The food dish, wash it. So any of their toys, wash on a really often frequent basis.
The hard toys also?
The hard toys also soap in water,
Okay.
because those what you don't realize is bacteria can grow on dry surfaces too. So after they chew on something, every time, for instance, every time you kiss another human being, you're transferring millions of bacteria back and forth. The same thing with a dog. And if a dog is chewing on something and then they leave it and it dries, those bacteria didn't go away. They didn't die. They're hanging out on
Do they
that.
ever die?
That's a good question. I mean, we know how to
I
kill
always
them.
thought if it was like a couple days later, maybe they died, but maybe not.
No, I mean, we're still, like microbes can go up into the space station and be fine and come back down.
Oh my goodness.
They're on asteroids that crash into, they're like buried in the middle of the Arctic ice sheets that have experienced a lot of pressure. Like, bugs are so freaking cool and so durable, and don't get me started.
And they're invisible, so it's like a battle that we can't even see.
Yeah.
But I really like those couple tips. Keeping the toys clean, water bowl clean. That's big. Like, that's easy stuff that we can do every day.
Easy. And then the softer, chewy stuff that scrubs up against and gets under the gun line, because when dogs chew something that's soft and plushy, it can actually get under there better than any toothbrush.
Okay. I always thought the hard chews, but that makes sense when it's a little bit more malleable, it can get into the crevices.
Yeah, hard chews are normally for dogs who have like a lot of tartar buildup. But in our research, we show that basically if you grow the right kind of microbes in a dog's mouth, there's very little tartar, because the kind of plaque that gets formed, which in microbiology we call biofilm, in dentistry they call it plaque, is a microbe's house. And they build their house. And so they build it based on what they're being fed. And so our diet directly impacts what the building blocks are of that plaque, whether it's super crunchy, fuzzy kind of plaque biofilm, or if it's slick and smooth. And then based on our diet, if we have a lot of calcium in it, then you're going to start to get tartar accumulation. And that's just a natural process. Tartar actually has been shown in clinical studies not to correlate with cavities or with gum disease. It's all about who lives under that tartar in that plaque, and what they're eating and what they're secreting, that highly correlate with cavities or gum disease.
Okay. I want to go back to the carbohydrate thing really quick. So if your dog's food is based with one type, it's better than having 3, and just like limiting the types of starch or carbs. Is that like a good
step? And spread the love, because we also know that the more diverse a diet, the more diverse the microbiome. And in the mouth and gut, more diversity equals better outcomes for your dog.
Oh, better. Okay.
Yeah. So for instance, Kashi, he'll get, some of the fish I make for myself, and he'll get like once in a great while, I'll throw him like a popcorn or, like a little bit of something. So he does get some carb, but it's usually hard
Mhm.
and it forces him to swallow right away. So it's not a soft carb like mashed potatoes or because that gets processed right away. If it's a harder carb, it'll get processed instead in the gut. But then again, it'll still get circulated as simple sugars in his blood and in his saliva. So that's why you always want to kind of limit the amount of carbohydrate and that total carbohydrate that dogs eat.
Got it. Not necessarily different types, just like the amount lower.
Totally lower the amount and then
Got it.
spread the love around and give them like a little bit of like rice or but not rice every day,
Mhm.
a little bit, you know what I mean, don't make it super consistent because then his microbiome will actually narrow
Got it.
over time.
Oh, that's so interesting. Okay. All right. So, I mean, a lot of times there's parallels between humans and dogs. So this is one that we can
Totally.
remember. Okay.
Absolutely. So like my grandma always said, everything in moderation.
Yeah, I like that.
Yeah.
I'll stick with that. Okay, cool. I want to talk a little bit about teeth and what what can I, well, for me personally, I'd love to know how can I avoid brushing my dog's teeth so often or at all if I could do something else that I know I could do every day that they can prevent these oral diseases.
Yeah. So, like I said, when I biohacked my grandma, we transitioned. I started then biohacking Tinsley and basically every dog in the neighborhood, and then expanded upon that. And came up with surprisingly, it's a very similar approach between the human and the dog. That's because we eat a lot of the same kinds of foods, and we have a lot of the same major species. There's tiny differences in exact identity, microbe to microbe between human and dog, but very consistent because we eat the same way. And so our approach was simply, let's make this as easy as possible. And so we decided to we came up with 4 ingredients. That's all, no filler, no starch, nothing that basically does all the work. So and you add it to the drinking water, which then allows it to constantly hit those microbes that inhabit all types of crevices embedded in the tongue, way below the gum line. We needed to reach all of those places to do 2 things. Use a stick to stop the microbes from eating carbohydrates, and then use the carrot to get them to try to eat protein instead. So basically the keto diet for microbes is what we found to be most beneficial for the dog.
Wow, that's so cool. So the formula in teeth does those things. It provides a
Yep.
cure, like it kind of steers the
Mhm.
microbes a specific way to behave a certain way.
Yeah, and it's super simple. It's like we found a fiber that soil bacteria make that actually they use strategically to outcompete other soil microbes for sugar. So it tricks them into thinking it's sugar. They latch on to try to eat it, and then they're stuck because the molecule, it's a fiber, so it's too big and they can't pull it in, and so then they starve. And then we're giving them vitamin B6 and an amino acid, which they can then use as a nutrient source to eat better, so that they'll secrete things that don't cause that aren't acid, that don't cause inflammation. And we're that because we're doing that, we're also then causing nutrient pressure on the microbes, which affects who can live under that pressure. So we wind up taking a dog which with really bad profile of microbes that are highly associated with bad things in their mouth, and we can change that within 7 to 14 day period and start to really grow beneficial healthy ones that help protect the dog, and then also starve the gum disease causing microbes that are associated with so many bad things.
Wow. So you're saying starting to supplement with teeth, or I don't know if
Mhm.
you would call it a supplement, but you can see results if your dog already has some
Yeah, it takes
negative signs
longer.
already.
Yeah, so like if you have like you'll notice with gingivitis, which is one of the first stages of gum disease, where there's inflammation or redness of the gum tissue, you'll notice that that can go down within, in our human clinical studies, it goes down in bleeding gums stop in 6 weeks. But in dogs, it's even faster, a
That's
couple of
awesome.
weeks. Later stage periodontal disease is so severe, it takes a lot longer to see visual changes, but you can definitely see it in the gums within about a 30 to 60 day time frame,
Got
because
it.
we've changed who lives there. And so that changes then the immune response and starts to slow down the immune system from attacking it, the tissue.
Wow. I'm
Yeah.
so excited. So we're going to be doing a challenge with you guys and have a bunch of dogs participate and kind of start and do this for 30 days straight and see the results. Can you talk a little bit about the like daily routine? Like, is it once a day or how do you use the product and what is
Yeah.
it?
Yeah. So I mean, for younger dogs or whatever, like this is the scoop. This
Okay.
is the jar. It's just solid 4 ingredients. There's no filler or anything. Sorry, my nails aren't nicely
So
polished.
it's a little powder.
Little powder. Put
Okay.
it in there drinking water every day.
Okay.
So how much a dog drinks is always, we're finding, to be the most variable, personalized thing. Dogs on a raw diet hardly drink anything. So you can like take some goat's milk or whatever, cut it, dilute it in water, and then use this, throughout the day. Other people like to brush their dog's teeth with this.
Oh, you can do that too.
Yeah. And then as long as they get, that dose a day throughout the day, their microbes are, we're getting them to do what they want to do, what we want them to do, excuse me.
Okay.
Now, if you have an older dog or a dog with really severe disease, what we recommend is starting out very slowly with like a half of a dose a day, because the microbes are so overgrown that it's actually, when they get starved, their reaction is to cause and manipulate their host to get more sugar to feed
To
themselves,
work
because they're
harder.
exactly.
Stop trying to stop me. I'm not going to let him stop me.
Exactly. So you can see some actual like loose stool or more frequent urination in older dogs. Particularly, there's some small dog breeds that usually have a ton of microbiology problems anyways, and so you'll see much more, almost a visceral reaction from the microbiome, which can manifest in dogs like rubbing themselves more often or urinating more often, or frequent or loose stool that's transient, but that's them leaving loudly.
Got it. So lesser dose, but keep it daily, or
Do it
would you
daily.
skip a couple
Lesser
days, or it's
dose.
important to do it daily?
It's important to do it
Okay.
daily.
Okay, cool. Awesome. Wow, I learned a lot. This is great. I'm really excited to start using this on my dog. We have an older dog who's 11 and he had his like first like cavity issue or I don't know. So yeah, he needs it. And then I have a young dog who's like 3.5.
Mhm.
And her teeth look great now, but I think being a little bit proactive
Yep.
and being able to catch it before it's,
Oh,
a big
for sure.
issue and those guys are really strong.
Yeah,
Um,
and I have a mixed household. I have two dogs and two cats, and they all drink out of the um which is fine.
yeah.
Yeah.
So we covered a lot, and I wanted to end with like one um, key takeaway for our listeners to help promote oral health. But I would maybe you can touch on three because I think you covered a lot of good tips that you can remember to do daily. So I'd love to
Mhm.
leave everyone with like a couple key points because it's Dental Health Month and we want to all do better.
Yeah. Yeah, sure. So really quick, not to freak everybody out, but dogs lose lifespan with every tooth that gets extracted. So our mission is to keep every single tooth in a dog's mouth for their lifetime so that they live longer and healthier. And the easiest way to do that are daily oral hygiene regimens like what we're doing for TEEF, or soft plushy chews, or bully sticks, things like that really can keep the gums highly circulated and remove waste. Change and watch out for those carbohydrates. They're all over the place. They're in dental treats, dental chews. They're in regular kibbles. So everything in moderation that way. And then the next easiest thing is to wash those dishes every day with soap and water to keep those clean, and wash the toys on a regular basis as well.
Noted. Great. Thank you so much, Dr. Stein. I learned a lot. I hope everyone else did too. And I hope we all can take some of these steps this month and make it a habit to give our dogs like some shiny smiles and a longer life. I love that.
Yes. Yes.
Cool. Thank you so much.
Thank you.